The focus of my laboratory and many of the abstracts that we have at this meeting is on the myeloid malignancies, and in particular AML and myelodysplastic syndromes, MDS. And so we've been focused a lot on epigenetics, sort of what are the ways that which MDS or AML cells maintain their identity as malignancies with the hope of triggering differentiation of the cells. And so Ronan Swords, who's one of our leukemia doctors, has a poster suggesting that using all-trans retinoic acid can stimulate these cells to differentiate, this being AML, in the context of an EZH2 inhibitor. And so what that work shows is that an EZH2 inhibitor by itself does very little, and the retinoic acid by itself does very little, but when you combine the two, that you see a synergistic effect in terms of killing and differentiating AML. And that sort of study follows on a clinical trial that we have ongoing using all-trans retinoic acid and an LSD1 inhibitor. Ronan and Arthur Zellant, who's a PhD scientist and a world expert in retinoic acid signaling, has been conducting in patients. And so our goal here is to develop new therapies using preclinical models. We have 2 MDS preclinical models that we're presenting, and then to take the preclinical information and as rapidly as possible translate it into benefit for our patients. So in terms of the preclinical models, we've been working with Michael Karras, who's at Memorial Sloan Kettering Cancer Center in New York, and he's identified a RNA binding protein called Musashi2 that plays a very important role in MDS development and progression. And so he's been working in his lab on getting inhibitors to that, but together with his inhibitors and our mouse models, we're trying to evolve combination therapies that allow us to differentiate AML and MDS cells. We have a couple of oral presentations from our lymphoma group led by Isidore Losos, and he's been looking at signaling in lymphoma cells, some of it epigenetic, others more traditional models like NF-kappa B signaling. And so the focus of our efforts are to develop therapies that can be used potentially with immunotherapy in the future, but to have our own new targets that can be identified that are important in the aberrant growth of cancer cells, and then to develop with either pharma or with our own chemists small molecules that can affect the function of these enzymes.